Hey, chiropractors, welcome to Modern Chiropractic Mastery with your host, Dr. Kevin Christie, where we discuss the latest in marketing, business, and professional growth with some of the leading experts in the industry. All right, welcome to the show, Brett. This isn't the first time, but I'm really excited about this topic. You know, I've been trying to find this sweet spot of great clinical care and making, damn good money, because I think chiropractors out there deserve it. And I hear a lot of different things from different chiropractors, and I know you do. And one of the things that I think we're struggling with from the, let's just call it the evidence-informed crowd, is finding that sweet spot. And I'm going to have you help us dive into that today. But before we do, give us a little bit of update on what you got going on these days.
First of all, I want to thank you, Kevin, for having me back on. We all listen to your podcast, so your podcast has been very helpful for myself and all the other docs. So I really appreciate you doing such a good job and the persistence that you've done with your podcast. It's just, post COVID, the teaching kind of all cranked back up. So I'm on the road again, not so much internationally, but definitely within the U.S. and we're running our own kind of clinical podcast called Gestalt Education. So that has really kept us busy. And now the clinic, constant management of the clinic. The clinic is constantly evolving. It's, I guess a true multidisciplinary clinic where we have obviously the chiropractic side of it, but we have massage therapists, health coach, functional medicine, medical doctors, trainers, ATC. So it is like a lot of your listeners. I mean, now a part of my job is just managing people. So
yeah. And that's why I kind of cherry picked you for this particular topic, because I didn't want to bring someone on that was just all business. I wanted to bring someone on that was really foundationally clinical and built a practice and has done it in a way to where now, it's evolved, right? You got a great practice that you're overseeing a lot of people, providing a leadership role, but then you're on the road training other chiropractors from a clinical standpoint. You've got the podcast going on, which you're kind of that investigative reporter on the clinical side. I know you just had I think Dr. James Andrews on your show.
Yeah, what a superstar he is. Oh my God.
And so and I think the moral of the story is, and I know I'm in a similar boat, whereas your focus on having a really good practice that's serving people has ultimately freed you up to do things that are a little bit more kind of I don't want to call it a passion project, but the podcast can be that, right? Like it's just something that not everybody gets to do. And you found that the ability to do that. And it seems like it's definitely serving your passion.
No, I think that is exactly right. It's just, I feel like over the years, I personally have accrued a bunch of relationships. And I feel like what the podcast has been able to do is kind of tie it all together. And, like the younger generation, for example, they don't even know who Gary Gray is, for example, so I've really, kind of thought long and hard about who would make good guests. And we're trying to time it out in a good way also, to where they're spaced out in the right way. But that's been basically the main inspiration, is to kind of expose some of these people and then also have some difficult conversations, but then in the end, try to integrate all together and kind of, with any technique system, you're going to have your high points. So kind of get rid of some of the fluff and kind of talk about what actually changes your and I practice. And that's kind of been the goal of the podcast, but it's been so much fun. I mean, it's just been a wonderful year and a half. Taylor and I are just having a blast with it. So
yeah, and you got such a unique opportunity to where you're going in person and it's video and audio, and you're getting in their environment a lot of times, which is just cool, and I had a good time being on the podcast as well when you were here teaching DNS exercise 1 to our group down here, which is where I want to kind of springboard from. And I remember having a pretty distinct conversation with you over coffee about, what are like the 4 things you would really like to have clinically in your tool belt. And then you kind of segued a lot into being a clinical sniper in a sense. And we're going to really touch on clinical efficiency, because I think what's happening, and you can correct me if I'm wrong, and I'm going to let you take it from here, is that When you and I graduated, I know you graduated a couple years before me. I was fortunate enough to actually have a class of yours, but you were one of the early people to get me into MPI. When we graduated, we just had a couple skill sets underneath us, other than evaluation, but it was, manipulation, some soft tissue, a little bit of rehab. But a lot of these young DCs now are coming out with all kinds of great tools, which is awesome. But for people like you and I, we kind of added over the years, and it gave us a little bit of time to digest one thing, get efficient at it, then add the other. Whereas I think a lot of the younger DCs are coming out with all these great tools, but maybe not being able to put it in a system of care, or however you want to word it, to where they can be efficient. Can you speak to that a little bit?
Yeah, I mean, the way you teed it up was exactly what happened. So I graduated in 2003, and basically, like the contemporary chiropractor at that point, they were utilizing ART, MPI, and traditional Craig Liebenson rehab. So, and at that time, that seemed overwhelming.
Yes.
So, and then as you correctly said, as we've, moved along, I mean, there is a new technique system or new seminar rolling in and out of a town like St. Louis every weekend. So the average chiropractic student or young doc, they really feel this obnoxious neurotic pressure to try to integrate all these different things in. And I mean, I'll just bring it back full circle. Mm-hmm. I think too, I mean, if you don't know how to integrate all these new wonderful things you're learning, the original model might have produced better results for you. So that's where the integration piece becomes so critical. And Lynn Fay said it to me when I was a student, and I was kind of pushing some limits as a chiropractic student, and he kind of pulled me aside and he said, "Brett, all this rehab stuff is wonderful, but," he goes, "you put in so much time and effort to be good at what you're doing. You deserve to earn a professional income." Mm-hmm. And I said, "Yeah, that is exactly right." And so I just straight up asked him, I said, "Well, what is a professional income?" And he asked me where I was going to practice. I'm like, "Well, kind of small town Missouri." And he didn't even think about it. He's like, $100,000 a year. So that kind of gave me my foundation. So now, the thought that I always tell our interns is a professional income, and it depends on what part of the country you're in, but I mean, that's a 6-figure income within 3 years of you starting to work. And if you can't pull that off within 3 years, either you're in a bad system or it's you. So, I mean, sometimes like people just have to look in the mirror and say, this is on me. I got to figure out how to be better at this. But that at least give you some guideposts. We have chiropractors now that are making $40,000 a year, which, I mean, nothing is wrong with that per se, except for the fact that you went to school minimum 6 years to get to this point. So, I mean, it's unfortunately too, I can't think of another profession where it's like this. Like if we took like the upper crust of our profession, a lot of times they're making the least amount of money. And you got to search long and hard to find a situation that is like that. Usually, no matter what it is, whether it's athletics, sports, sales, business, when you are the best at what you're doing, your pay is reflective of that. So that's where it gets kind of tough. So, back to the original question, which was the integration piece. Yep. So how do we do this and, have a successful income? Well, one of the main things that, I think I'll go to my grave saying is the assessment tells you everything. And I guess the fatal flaw that I see out of young students and I see out of young docs and old docs, honestly, is they are 100% over treating their patient. Like you would never, ever, ever go to your dentist and the dentist is like, "Okay, today we're going to do porcelain veneers. We're going to fill 3 cavities. We're going to put braces on your teeth. We're going to whiten your teeth." They would never do that. And I know that's like a gross example. However, like I feel like in our profession, our young docs are feeling the need to hit our patients with 20 different things. And there's a lot of redundancy in the treatment that they're doing. And honestly, and I learned this from one of my mentors originally, Clayton Skaggs, he was the master at not over treating the patient. And I mean, even like if you look at like a Lynn Fay or Mark King, they'll tell you the same thing, which is we want to, like, if we're just talking about manipulation, I mean, the big thing is maybe find one or two areas, make sure those one or two areas are moving well in all three planes of motion, and then let it be. It's a lot of times we don't get the desired outcome because we're completely overutilizing or over treating our patient with our techniques. And so what's so beautiful about it is that actually works perfect for what you and I are trying to create with our profession, which is we just need to, do what we need to do today. And then we need to literally walk out of the room and watch the outcome. So I would say to the group of people that's probably listening here, maybe the biggest mistake would be honestly doing too much in a treatment session.
Yeah, I agree. And, there's the clinical side of that with too much time and over treating that's happening with that. There's also the psychology of it. I think a lot of chiropractors think they're in a time-based economy versus a results-based economy, right? Like they think that they have to spend more time. Yeah, there's a point of no return. And again, so much of this goes back to trying not to be like the other side of the profession, right? Where we don't want to give long treatment plans. We don't want to spend 3 minutes only with the patient, like all the things that we see the other side of the profession do. We go too far to the other end of the spectrum, and they think we're in this time-based economy. But the problem that I'm seeing as well, and then we're going to circle this back to the treatment side of things, but they're applying the old model of financial reimbursement of chiropractic to this new model of care, right? So they're either in network with insurance and they're getting $53 and they're spending 33 minutes, or they're a cash practice and they're charging $50 and they're spending 28 minutes. And that math just doesn't work in this setting. And so we have to find that middle ground to where you can get great results with the patient and have a reimbursement model where the math adds up to $200, $250, $300 an hour capability in your practice. And I think you hit it on the head with the over treating, because not only does the over treating have a side effect for them clinically, like a bad side effect potentially, but it also has a bad side effect to your practice, right? So I heard you talked about the minimal effective dose. How does that play into this? I'm assuming that's kind of the antithesis of over treating, right?
Right. So another like huge influence on my life has been Stuart Mcgill, PhD out of Waterloo, Canada. And he, to this exact point, he used to tell a story about he saw an office worker who had a low back disc herniation, who was sitting at a desk and occupationally all day long, the way they had the phone set up, they were reaching across the desk with flexion over and over again. So I'm sure the story's been enhanced over the years, but basically the fix was just to move the phone to the other side of the desk. Mm-hmm. And so, then, somebody could say, well, you didn't even do anything. All you did was this. You spent hardly any time. And what Stu McGill used to tell about this is, you are actually not paying me for my time. You're paying me for my knowledge. Mm-hmm. So, and I kind of go into the treatment room always thinking about that, because at the end of the day, and I would just encourage and inspire everyone that's listening on this thought. So you can make more money if you see more patients. Of course, that math makes sense. The other thing that people don't realize is, if we can see more patients, we actually accrue more experience. So at the end of the day, if I've seen, let's say 30 patients, and my buddy's seen 6, well, I've actually had, then 24 more opportunities to get myself better at what I'm doing. So you can see more things, you can help more people. And of course, this is all like on a spectrum, basically. Mm-hmm. There is a point of no return where you're seeing, let's just say, too many people in not enough time, and then you're not actually making yourself better. And we all know that's, the other half of the profession. But to the original question, which was about minimal effective dosage. So this is no different than like, supplementation or pharmaceuticals, where you don't, we wouldn't recommend that you overtake a supplement, because if we do that, then obviously we cause problems. So really what we want to do is we want to find the perfect amount of dosage to the patient. That means manipulation, soft tissue rehabilitation, maybe neurodynamics. And then at that point, then we're done. So, if we keep going, which is common with a young clinician, we may get the same result, but we're probably not going to get a better result at that point. So why not just cut it off at that time frame there? And that's when I talk about minimal dosage. It's about finding exactly what I want to do today and then plugging that in. And I would say that the most common reason overtreatment occurs is because the clinician has not thought their way through the treatment plan effectively. So, because if you thought it through at the end, we all call them doorknob patients, where you're trying to get out of the room and they're like, do you have any more exercise on this? Imagine if you came back with them with certainty and confidence and said, no, this is all we want to do for today. You do a really good job with this. And then next week we start your strengthening program, or we start your neurodynamic program, or next week I can't wait for next week because we're going to introduce you to these DNS principles. And I think that's another thing that I myself have gotten good at, which is I'm always giving them a link or an anchor to the next thing we're doing. Because, and I know, Kev, we're going to get into this, but like the key thing that's got to be conveyed to the patient is what I'm really good at is changing the function of the patient, not necessarily changing the pain. Because to be honest, the medical doctors here are way better at immediately affecting pain than I am, just because we can give you a cortisone shot, we can, give you prednisone, whatever it might be. But so my big thing is to change function. And when the patient understands that, then that is a very liberating moment for the young chiro.
And that's the irony of it too, is a lot of the chiropractors we talk to, they talk about function and they talk about movement, and they talk about all these things that we all get, but then they get in the room with the patient and they make their clinical judgment based on releasing that patient from care based on the pain, right?
100%. So the true functionalists, and those would be the peoples in our circles. I think you nailed it. I think we probably find, not in a bad way, but they're probably a little bit hypocritical, just like I was, or you were when you were young, So if you're a true functionalist, you're basically not affected by pain. So what I mean by that is, let's just say that, today's Tuesday, we saw a new patient last Friday. The patient comes in and they're like, I'm 100% better. Like not falling in the trap to trying to kick that patient out, but then like coming back to their body and the audits to kind of see, or the checkpoints and kind of see, yeah, I'm glad you're feeling great. We still got these things we need to work on. If I were to release you today with this stuff still being dysfunctional, you will relapse within 2 weeks. And that's a common thing I say when I'm teaching is, like when that occurs. So, and this is a common scenario because what we do is so powerful. You saw them today, the next day they see you, they're 90% better. The young clinician's already trying to get them out of the office because they haven't changed the true function of the patient. Within 2 to 3 weeks, the likelihood of that patient relapsing is probably high, quite honestly.
Yep.
And then what determines whether or not they'd actually come back to you would be how good your personality is, literally. So, and for me personally, what happened was Troy, Missouri is, especially when I got here 20 years ago, small town,
Yep.
So I got to see all my successes and failures. And to be honest, early on, people did really like me because they, I thought I could fix everyone in 2 to 3. I wasn't overutilizing. But then I noticed a horrible trend when I'd go to Walmart or Walgreens or out to eat, where I would see my old patients that I thought were literally, quote fixed, unquote fixed. And they were, they had ended up having surgery. They ended up doing something else. Basically, they did what, I didn't want them to do, essentially. So that is what basically shapes the clinician, is when you get to see your results. If you're in downtown New York, you never get to see your failures. I got to see my failures, and I was honest with myself, and I'm like, I was good at changing pain early, and I was not good at changing function. And that was a big deal breaker in my career for me.
All right, docs, here is a new opportunity for you from Darcy Sullivan of Propel. She is our SEO specialist and helping out many chiropractors. with their search engine optimization and making sure Google is finding you and getting you new patients. It's amazing how many new patients chiropractors can get and are getting when they do the SEO right and a few other things. And Darcy is offering a free SEO workshop just for chiropractors, and you can sign up for that at bit.ly/propelmcm. That is bit.ly/propelmcm, modern chiropractic marketing, right? And so check out that link, and we're going to have you go over 5 SEO secrets to owning the first page of Google without buying ads. And Darcy's going to give that free workshop, 1 hour, to really help grow your practice and start churning new patients from the ever mighty Google, which is still king in the online marketing. So check that out at bit.ly/propelmcm for the 1 hour free workshop. Hey doc, are you moving office spaces, or you're a startup with your own new space, or you're like me where you need renovations because it's starting to look a little worn after about 10 years like ours is? Crossfield's Chiropractic Office Design is here to elevate you wherever you're at, and they're going to help maximize your space and flow. They're going to really help attract and retain patients, and this is going to have a great ROI on your investment when you increase that patient experience. So check out Chiropractic Office Designs by Crossfields, and we have a special link for Modern Chiropractic Marketing listeners, and that is www.chiropracticofficedesign.com/Kevin-Christie. And with that, you're going to have discounts. We're going to have direct links to a mega bundle of free resources, and you can check them out, and you can get 15 of our most popular floor plans, 5-phase checklist for a startup office, 5-point designer checklist to evaluate your current office image. And there's 30% off on all online products when you go to www.chiropracticofficedesign.com/Kevin-Christie. Yeah, that's huge. And a lot of this is really improving communication. And I've talked to a lot of chiropractors about having certain phases of care, right? Like, okay, and maybe they get out of pain. That's an opportunity for them to now graduate into some more of the other stuff that you really couldn't do because there was pain, or different strategies that you talked about. And that goes back to what I want you to dive into a little bit more is maybe this failure of proper treatment planning by DCs and how that's playing a role into this whole thing. So can you dive into that a little bit?
Yeah. So I think like where the big mistake occurs is I really believe most new patients, I mean, you got to get them committed for 3 weeks, so, and then at that 3-week mark is where I think like things start to fall apart as far as the education of function. Mm-hmm. So the reason I choose 3 weeks, why I like 3 weeks, is if your patient is dying of METs, that would be horrific, but let's just imagine, and you make a good call at 3 weeks, from a litigious side, you're still fine. The patient didn't respond. You made a good move at 3 weeks. You got the imaging, you made the proper referral, everything's good. So I like 3 weeks for that. The other thing I like about 3 weeks is it gives you a time to establish a relationship with the patient. So the big mistake that people make, in my opinion, is it's no different than like if you go on vacation and you get like hooked into a timeshare, like you automatically start getting weird, like you feel uncomfortable. They're like making an aggressive push. So I think what the chiropractor is trying to do this, the big mistake they make, they try to educate like these 4 different phases that maybe we're talking about now. They try to hit them with all of that on day one. And it's no different than like a timeshare. Like the consumers just immediately like, whoa. This is not what I signed up for. Yep. So like, and I always say like jokingly, like my good patients, I mean, they're going to happily give me $10,000 a year through all the different services in our office. They're not going to realize they're doing it though. Mm-hmm. Like if I hit them hard on the front end and I said, okay, your care plan is going to be $10,000, they would probably storm out. Some wouldn't, but a majority would leave, So I think like when done well with tact and like with integrity, like it just can happen naturally. But I think like the chiro makes a mistake in like, just give them a second to like get to know you and to like you. Mm-hmm. And then at that 3-week mark, then just, the most common thing you and I are going to find after 3 weeks of treatment for the average case, they're 90% better from a pain standpoint, and they're probably 75% better from a functional standpoint. So then what do we do with them at that point? That is where a lot of times they fall off into this black hole. And I work hard with our chiros here, is that what do you do with the patient who you didn't get a miracle with in 2 weeks, but does not need an orthopedic surgeon,
Mm-hmm.
So then that patient just needs to have their function changed over a period of time. And guess what? It might as well be you. So, so what ends up happening is, and think how few cases required orthopedic referral. So what are you doing with the people where you didn't get a miracle in a week, but are not going to require surgery? And that's the one, these new evidence-based group, they completely dropped the ball on. So, we need to automatically be educating function with them. We need, to be showing them. So I think people will, I like to use the example, and I know, Kevin, you're well aware of this establishment, but there's a restaurant in Chesterfield or St. Louis called Annie Gunn's.
Mm-hmm.
And I've been to some nice restaurants. This is literally my favorite restaurant in the world. It is a little bit expensive, but I don't mind paying it because the customer service, the food, the wine is that much better than the next place down the street. So what would be a problem, though, is if, I'm paying extra money and I'm not seeing the difference,
Mm-hmm.
So I think you got to be sure that you're like showing the consumer, and usually that's going to, stand on its own, because they're going to feel better, and they're going to know they're in good hands, and that you're a little bit different. But I think that is a really key point. I think these people who are trying to do what we're talking about, they're front loading too hard. You need 3 weeks to establish rapport. And then at that point, then you start, then they'll be on board for whatever you got. So I just think that the average person is it's coming off wrong early. And because of that, they're pushing the patient away.
Yeah. And I want to touch on that a little bit, because you mentioned, they'll spend the money through the course of the year, and it's just because they're seeing the value. Once they've come in, they say, oh, this is the real deal. They've gotten a few weeks to know that you're clinically sound and you care, and the staff is nice. And so it's not like you have to do that hard sell like the other chiropractors are selling, year-long treatment plans on visit 2, where that's a sales job, right? That's a high pressure sales job. There ends up being buyer remorse. They're frustrated, but they can't get out of it. That's why those chiropractors have to put all kinds of different tactics into hard selling the big care plans. Whereas over that 3-week period of time, it's just given them an opportunity to see the value, and then be willing to say, like, yeah, I'm going to keep coming here. And, obviously your practice has functional medicine, all these other different avenues where they can improve their health. But they're going there because they see the value versus that hard sell. It's just like Annie Gunn's. You're going there to see the value because you see the value with it. And
right. And then the other thing I'd say, the patient who does not want to spend 3 weeks with you, now that patient you literally do not want. Nothing is wrong with some people have their opinions on the joint and stuff like that. Like that consumer right there, they should literally go to the joint, because that's like kind of the service that they're providing.
Mm-hmm.
So then, whereas this is you need a 3-week commitment. So because everyone's going to say, well, what if my patient doesn't want that? I'm telling you, like, that is less than 1%, but that 1% can utilize a service like the joint, or, another, that's just going after a different patient base, probably,
Oh yeah, for sure. And that's why, like, we're having our mastermind. Actually, when this one comes out, we've probably already had our second weekend, and we have strategic coach coming down to guest present. And we're talking a lot about the dangers, opportunities, and strengths of our ideal patients. And one of my ideal patients is they need to be value driven. I don't want the price shoppers coming in. Now, if they come in, it's going to happen, but I'm going to gear my messaging and my business and practice around people that see the value in this. Once they start haggling or all the different types of things, like, I'm not going to put a lot of effort into that. And I'm very clear on it. And I think if you design your practice like the way we're talking about today, you'll start to attract the value driven consumer and repel the price shoppers.
And if you can get this done well with tact,
Mhm.
I mean, then the doctors here all make fun of me just because, like, I will literally get that person to tell me in 3 weeks. So I'm really kind of digging this. So what does this mean long term? And then you can educate them even further. But my point on that, and I'm just speaking from my own scars of learning the hard way.
Mhm.
But like when it's set up well, they're already starting to like ask you questions about the future. It's kind of like, and I cannot stand the term maintenance or wellness,
Yeah.
but like in a functional way, I'm doing the same thing. It's like everything you wanted your maintenance program to be, but wasn't, but
Mhm.
like when you have someone who truly understands the body well and all different facets, then like people there's a place at the table for you in their healthcare team.
Mhm.
And I've heard recently Shirley Sarman, the great cooks of the world, they are now even in the world of physical therapy trying to educate people like we need to do checkups on our patients. Like back pain is such a, chronic back pain is such a layered problem. To think that you're going to fix that case in 2 or 3 visits is insane. So, just basically, I mean, swerve into it, if you will,
Yeah.
and, do it the right way. And you're going to have your personalities too that, they're going to kind of come and go. And Mark King used to say this. He says, make it easy for them to come, make it easy for them to go. I think like the true like savant in practice, what they do really well as far as like a human management thing, they can walk into a treatment room and they can read what that person truly wants for them. And then they kind of keep everybody, like they keep the person who came in a suit, they're, 50 years old, type A business driver, blah, 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 like who thinks they're just incredibly busy. Like you have a lot to offer them if it's packaged the right way. And then you got your, your granola type patient who's going to love everything you say anyways, but the true master can get to both of those people when done well. But I think also understanding the consumers are different and being able to read that. And what I mean by that is that, like the dentistry is a perfect example. I'm supposed to floss twice a day. Well, admittedly, I haven't flossed my teeth in the last 2 weeks, right? It's not a priority. I'm good at brushing my teeth, but like that doesn't mean that I'm doing everything I'm exactly supposed to do.
Yep.
Now, there are patients out there that are going to floss their teeth twice a week, and I mean, those are the easy ones. So my point is, being able to reach people where they are, expose what you can do for them, and then they can make a decision. And I mean, 99% of people, they're going to be on board for it if you expose all the possibilities to them in the right way.
Yeah, definitely. One of the things we've done to combat that whole maintenance wellness that I don't like either is we call it optimal performance care, and then we use some messaging around that where we're like the training room for their life, right?
Oh, I love that.
Yeah,
I'm writing it down as we speak. I love that.
Because like performance is like, okay, it could be performance in work, performance in sport, performance in life, right? And then the training room for their life, we just try to realize like, look, we're the place you can go to come in when you got an issue or you want to stay on top of things, and we could put out any fires or whatever. And just like the athlete goes into the training room when something's awry. And so that's what we've been doing to have another opportunity to communicate with them to stay on top of their health. And so that's it's been effective. We've done that for probably the last 6 or 7 months now, and we've liked it.
Oh, I love that because so, I and this is two opposite ends of the continuum, but I always, tell the students, are you walking into a Ferrari? Are you walking into a Ford Escort? Nothing's wrong with a Ford Escort by any means, but they get treated differently.
Yeah.
So, for example, if you're working with a sports team, well, you're just automatically working with 25 Ferraris. That's just the way that it is. Now, if you smoke 2 packs of cigarettes a day, you drink too much, you gamble, you swear, you got all these bad things going for you, and you got a little bit of back pain. Well, you're more like the Ford Escort. I still got a lot of things I can do to help you. Now, some Ford Escorts are wanting to be converted into Ferraris and some are not. So you owe it to the Ford Escort to show them the possibilities and, try to get through to them, which you'll get better as your career goes along at being able to make that conversion. But then sometimes you just got to accept that you're a Ford Escort. So I'm not doing like very difficult, complex DNS positions with that person. I might be, if it's a low back disc herniation, I mean, we may be doing 10 press ups twice a day, and that's their program, besides treatment. So I think, again, back to the minimal dosage, like being able to see, what am I walking into? Minimal dosage. What do I need to do to have a huge effect here? And, do I need to talk them into something? Let's just say that, they have celiac disease. We do blood work on them and they have celiac disease. Well, I have got to choose my words in a very motivating way, because I literally cannot have that patient consuming gluten, for example. So, they don't have a choice. I don't care who you are, how busy you are, like you literally can't do this, or you're not going to be around here in 15 years, so, finding your words to, reach all people is, as Mark King would say, be a chameleon,
You're listening to Modern Chiropractic Mastery with Dr. Kevin Christie. Find more online at www.modernchiropracticmarketing.com for more free resources, online courses, and the Chiropractic Success Academy. Now back to the show with your host, Dr. Kevin Christie.
Yeah, no doubt. And then just to kind of finalize the treatment planning things, you and I had discussed a little bit of where a lot of the chiropractors that have all these tools are throwing them all at them on every visit. I just want you to encapsulate a little bit that you're graduating them a little bit step by step. So they may not get the same thing on visit 6 that they got on visit 1. And so you can really spread out the care over that few weeks versus feeling like you have to throw the sink at them every visit. Can you just kind of just put a bow on that a little bit?
Yeah. Well, I think too, the young clinician, and I'm in the same boat. They have this neurotic need to think they need to keep advancing their exercise program. And why that becomes really important is that is a huge time suck.
Yep.
So like if you're changing an exercise every time you're seeing them, I mean, I think like I've actually like looked at the time of teaching exercise with our interns and stuff like that. I mean, you're looking at, that's a best case scenario, 5-minute, but more likely a 7-minute process. So if you're wasting all that time doing that, then it takes away from your treatment time and everything we were talking at the beginning of this podcast. So instead, if you have a sniper approach in your assessment and you find out exactly what is wrong with them, you've created an exercise that, is hopefully encompassing all their major dysfunctions, 1 or 2 exercises. And then I motivate them hard on that. And then really, usually I don't change that exercise for weeks, literally. So I might walk into the treatment room, or maybe the intern or CA checks up on the exercise, but I walk in and, I might say, show me your exercise. And then I don't revisit that until I feel like we really do need to advance the exercise. So I think that is also a huge mistake in this new contemporary rehab practice, where they are constantly, almost neurotically looking for the next thing. And I would just say, if you found a great exercise for them, let them run with it. Let them get excited about it. Think of it like brushing your teeth. We don't look for more creative ways to brush your teeth. And, this is a great thing to do to keep your teeth healthy. So just keep doing this, And then I would also say, sometimes on exercise, put endpoints to their rehab. Besides brushing your teeth, no one really wants to be told that you have to do something every day for the rest of your life. Yep. So I think what I always tell my patients is like, today is, and I always tell the date, I'm like, okay, so if it is, mid-April, mid-May, May 15th, we are going to work really hard on this. That way in their mind, they're kind of understanding how long it's going to take. Once May 15th hits, this is what I want to start working on, and I think that has created a lot of success for myself. But I mean, back to the original question, I think you were trying to ask me, which was, the assessment is what is so critical. So let's just start with directional preference. There's over 60 papers telling us that if we can find the direction to move a joint at end range repetitively, that, we're going to have a miracle in 72 hours, So I might search for that the first couple of visits. They don't even know that I know anything about DNS at that point. Like I never, ever get ahead of myself. So if you look at great, in my opinion, great coaches and, it doesn't matter what the craft is.
Mhm.
Usually it's very simple, not over talking, definitely not getting biomechanical, and not going on like this 3-minute description of what you're doing. Hit the high points, tell them why it's important, and establish rapport with them and why they need to do it. And then you're off and running instead of like over talking it.
Well, that's like, I always use the golf swing analogy where it's like my golf swing is such that I got about 11 things wrong with it. And if I go to a golf coach and he tries to give me 11 fixes, I'm screwed. Right. But if he can find one thing that can solve 7 of them and I can work on that for a while, then we can make some actual progress. Right. And I think it's a pretty good analogy to what we're doing sometimes in treatment. Right.
100%. I mean, in day one too, there's one R word that you have to establish really early on. So of course it's rapport is one, but the other one is reassurance.
Mm-hmm.
So what reassurance does is, let's just say that we do find that they have discogenic pain or a disc herniation, whatever it might be. The consumer is so educated now. They've already Googled their condition. They're already in their mind thinking, do I need an MRI? Like what are all the next steps? So I will tell them, when I get done with them, I'm like, you have nothing to worry about. I have literally seen this a million times. We're going to be fine. Or I might say, if I'm a little bit unsure, I'll say, I have all your next steps. So I do believe you have a disc herniation. I've seen this a million times. You're going to do great. If you don't, I'm affiliated with the best epidural specialist in St. Louis at WashU. That would be the next step. And of course, the biggest option would be surgery, but I got all the backlines and the connections for that also, because I think like what the patient loves to hear, that if you don't get them better, that you have all their next steps set up. So that might be one call to action for the younger docs. Like you want to establish these connections for the patient, because I don't want to have to like truly outsource any of this. Yep. Meaning I tell the patient, like, your primary care, great doctor, I know them well, maybe I treat them, blah, blah, blah. Like when it comes to musculoskeletal health, I'm going to be able to help you navigate the waters way better than they can. Mm-hmm. And they're a little bit surprised by that. Like a lot of times they think their primary care would be better at being able to do that. So I always am like setting myself up for all scenarios. You're kind of gambling, and when you're treating, you're like with it, you and I learned from the best Norm Kettner, where he taught like differential diagnosis, like there's an 80% chance it's this. So if it ends up being in a 20%, I got you covered. Like I got all the other next options for you. So
that's great. I'm going to go on a little bit of a preamble. I'm going to ask you one final question. I know you're busy. We probably do a part 2, 10, 12, and 13 of this, but we'll keep it pithy. A lot of docs go to your office. They go to my office. They see nice offices. They see a well-developed team. They see a busy practice. They don't see the 20 years it took, right? But one of the things I think that is very similar in both of our situations was that we started from something that looked a lot different than our practices look now. And it did take time. It did take this escalation of improving our clinical skill sets, our tools, being able to hire people around us, really good people around us. And one of the things that I get concerned the most with the issue we're talking about is this lack of profit margin in practice in this scenario that we've outlined today, where too much time, not enough reimbursement, the math isn't working, the overtreatment, all that stuff is leading to this lack of profit margin. So they can't hire good people around them. And so they're constantly spinning their wheels and having to do everything. And it becomes, challenging for them to be a clinical sniper, because they're also taking credit card payment, they're answering the phone, and they're doing everything in that practice. And so I really want to challenge our audience that there is a way out of that. Profit margin is important. It allows you to pay yourself what you're worth, like a professional salary that you talked about. It allows you to hire people around you that are going to be even better than you at certain things. And that's going to actually provide a better patient experience than if it's just you. As great as you are, if you've got great team members around you, the experience will be better for your patient. And you ultimately will build a practice in 10, 15 to 20 years that you're going to be extremely proud of, and will free you up to have a podcast or travel to teach or travel to learn or just travel for fun. And so I really want our audience to recognize that you and I aren't really having this conversation. It's not meant to take advantage of patients and make as much money as you possibly can. It's about being patient centered, but also doing it in a way that allows you to build a thriving practice and thriving life. And so my question for you, Brett, I'm going to put you a little bit on this spot, but I know you'll be able to answer it. There's a lot of docs out there that are starting out, and I think they fall into the issue where they don't have a lot of patients on the schedule, and so they feel compelled to spend a lot of time. I remember early on, and it was instrumental for me. You kind of talked about you gotta treat the patient, even if you have 2 that day, just like if you had 32. So that way they don't get trained into expecting 35 minutes of your time. Can you just speak to that a little bit, and then I'll let you go?
Oh yeah, no, I mean, there was, back when I was in school, the practice management people would tell you, like, even if you don't have another patient, you at least need to walk into an empty room like you do have another patient, and just, like you said, don't fall into the trap of, so I mean, I think like this is one thing we probably need to talk about, like, so in the gym office hybrid, which I'm a big fan, we have a gym here, but we got to be careful to where, like, there's, and Bobby maybe actually talked about this on a Facebook post. I thought it was actually really, really good, which is, like, do you, like in the treatment room setting, you just, did a full neuro exam on them. I mean, 2 minutes later, are we swinging a kettlebell with them? I mean, it's just kind of the optics of it look weird. I'm not saying that you shouldn't do that. I'm just saying, like, you could actually time that out to where that would make more sense to the patient. To your other point, so when your practice is small, you want to be really good at taking one patient and turning them into 10. Unfortunately, because of poor personalities and poor bedside manner and things like that, people take 10 new patients and they literally whittle it down to 1. So, and you're going to learn real quickly, if you're honest with yourself, either you're exploding your practice or you're not. And if you're not, then you got to start looking at some of these intangibles. Because to be honest, like, some of the best chiropractors in our profession, they have these little tiny practices that nobody knows about. So, and that comes back to what you're so good at, which is, being able to communicate better to not only to your patients, but to your literally your community. That way they know this wonderful service that you're committing. And the starting point, I think that's the other part of the question, which is, if you're a young doc, and it can be hard, even like with us with ChiroTouch. I mean, when we run a report, there's just a lot of numbers that a lot of people wouldn't be able to make sense of. So what I think makes more sense, and I started doing this a while back, helped me out a bunch. I just look at my profitability per hour. So I know I call it my overhead triangle, where I have two people up front and a CA in back. So I'm going to have that amount every hour. I have a salaried office manager. I got some other costs, but anyway, so those are like my hourly cost of doing business. And then I have how much money I'm bringing in. So when you break it down to a micro level like that, you can see real quickly if you're profitable or not. So what a lot of people are going to find is they do the math on their overhead, and then they do the math of what the money that's coming in. Real quickly, they're not profitable. So, that's where you got to start. Maybe you tweak the overhead, or you tweak your profitability, or things like that. But that's a key number that I look at to see whether or not I'm profitable. And to the point of, nobody gets a practice like you have, or I have, or Mark have, like right off the bat. It's just literally not even possible. Like, this is a 20-year amalgam of me and you, like, evolving along the way. When I started, it was literally just me literally doing everything. So, like, I mean, and I get it, but I mean, I think it's good because, like, it's inspiring for a young clinician. But I mean, and the other thing too, when you're a young clinician, the only thing you can do right now is get the person better that's in front of you. So if you can do that really well, then just, continue doing what you're doing. But a lot of times people are, there's a difference between dreaming and implementing. So there's plenty of dreamers in the world, and there's not that many implementers. So you got to be sure it's good to dream and it's healthy to dream, but you also got to be sure that you can implement and manifest your dreams.
Awesome, man. I really appreciate your time today. Tell us how they can find it. I know you got a nice little website. I don't know if you want to send them to Gesalt's website. It'd probably be the best way they can find all the different things you're doing.
Yeah, I mean, as far as like we always joke, the only thing that's truly free in the world is the podcast. So that is Gestalt Education. So we got some amazing ones, kind of just like getting ready to come out. And I'm actually pretty proud of the ones that have come before. So and obviously yours turned out great. So if you haven't listened to Kevin on our podcast, I think it really turned out good. So there's that. We have obviously, like you said, we have an office website. It's Winchester Spine and Sport. And yeah, you can get a hold of me on. I'm from the old school, so they all make fun of me here. I'm only good at Facebook, and I'm learning how to be good at Instagram. So we'll put it that way. But Facebook Messenger or my email, which is bw@winspineandsport.com.
Perfect. Awesome. Thank you so much.
Thanks for all you do for the profession, Kev. So I mean, I know some things have kind of unraveled recently on the social media threads with the other half, but I mean, I think like you just keep doing what you're doing, and we're really, really proud of you, and the profession is better off for you doing this. So
I really appreciate that.
Yep.
Thank you. That is it for this week's episode. But before you leave, check us out at www.modernchiropracticmarketing.com for all kinds of free resources such as blogs and the podcast episodes. We've got online courses. You can check out the Chiropractic Success Academy there, which is an amazing online coaching system for you at a very affordable monthly rate. There's a free online course on the modernchiropracticmarketing.com website, so check that out. If you're interested in some one-on-one coaching, we can do that as well. We have all kinds of resources for you there, and we would also truly appreciate if you could rate and review this podcast if you're getting valuable information out of it. I can't thank you enough, and we'll see you next week.